The next talk will be by Richard Rosen. The topic will be Metabolic Assessment using Mitochondrial Oxidative Stress Imaging, a new clinical tool for detecting and monitoring substructural disease.
Good morning. I want to thank the organizers for inviting us. I want to thank my team for all their hard work. These are my disclosures, none of which are relevant. So adaptive optics has given us the ability to look at single cells within living patients. Here are some examples: microaneurysms, rods, cones, axons of single nerve fiber layer, ganglion cells. Let's see, forward. Okay. In fact, it also will show us subcellular structures, details such as axonal varicosities, which have been identified as mitochondria. And mitochondria, of course, you know, are the site of the electron transport chain, which drives the energy production in the cell. Oxidative stress from a number of sources, such as hyperglycemia, aging, environment, and increased intraocular pressure, has a negative effect on mitochondrial function, and in fact may be important in terms of development of diabetic retinopathy and age-related macular degeneration, and many other diseases which are more in the systemic area. There are a few take-home points that I'd like to share with you. First of all, mitochondrial oxidative stress is a key factor in a lot of these retinal diseases. Flavoprotein fluorescence is an imaging which is clinically accessible and may show slow substructural damage due to mitochondrial stress. And flavoprotein fluorescence may be useful for monitoring early prestructural response to therapy. So oxidative stress will cause oxidation of the mitochondrial flavoproteins, and this can lead to increase in fluorescence, which potentially may be used as a clinical metabolic biomarker. The mitochondria are present both in pretty much everywhere, but you can see them very nicely in this Cox staining of cytochrome C, which shows the rust color of the mitochondria within the optic nerve in the retina. And in fact, there are 18 flavoproteins which are present within the electron transport chain, 4 which are probably the most important. As flavoprotein increases, it's an indication that the mitochondrial membrane potential has decreased, and this ultimately leads to apoptosis and cell loss. Now, the Ocumet beacon, which is a new instrument, which is we're currently investigating, developed by OcuSciences in Ann Arbor, looks at flavoprotein autofluorescence in vivo, and you may recognize the site because it's ported into the EDON system. It uses a stimulating light beam of 467 nanometers, which is then with a very narrow acquisition at 535 nanometers, and gives you a score which over an area of about 22 degrees circular on the retina or over the optic nerve. And you can look at both the area under the curve and you can look at the peak as well. So here are the excitation and emission spectra, and for comparison, you can see the spectra of lipofuscin, which is over on the right, which contributes a little bit, but because of the very narrow bandwidth of the filtration, it's really not significant. Here's a comparison between the two types of images. So you can see that with this particular spectrum, the optic nerve is still bright where it's dark in the typical clinical autofluorescence spectra. So we've done repeatability studies which show that in both versions, first the laboratory version and now the preclinical version, it has good repeatability of about 4%. Flavoprotein fluorescence has been shown to be increased in a number of papers in diabetes, central serous retinopathy, age-related macular degeneration, idiopathic intracranial hypertension, and most recently glaucoma. As aging, looking at age-matched controls, you can see that diabetics and patients with diabetic retinopathy have increased levels of flavoprotein fluorescence. And in fact, patients with diabetic macular edema have even higher levels than their cohort with diabetic retinopathy. Here you can see the progression in glaucoma from ocular hypertension to between mild, moderate, and severe glaucoma. What's really interesting about this technology is, unlike autofluorescence that we're all used to using in our practice, this has a response to therapy. So it will reverse. And so this gives us tremendous potential as a biomarker. Here's an example of a patient with diabetic macular edema who's treated with steroid, which shows a reduction in the flavoprotein fluorescence of just about 7%, which is not very much. But then the patient is given an anti-VEGF injection, and at 11 weeks, it's dropped down 24%. Here are the graphs of the same indication with the same situation where comparing it to the age-matched controls. Most recently, Romo demonstrated in a patient pre- and post-injection of anti-VEGF that it correlated, the flavoprotein fluorescence correlated better with best corrected visual acuity than the central macular thickness in OCT. And here you can see some examples where you see the OCT gets less, but the flavoprotein fluorescence numbers actually decrease more and closer to what the patient experienced. So now you have an objective measure that correlates with the patient's subjective finding. And here are the graphs that show that. So Jeff Goldberg, who's interested primarily in glaucoma, showed that in a series of cases where you have compression of the orbit around the eye, that by decompressing for doing various maneuvers, this is a carotid-cavernous sinus fistula, which is decompressed, and you can see that the flavoprotein fluorescence decreases after the patient's treated. Here's another patient of his that was treated with chemotherapy for lymphoma, and you can see that the levels decreased. And here's a third patient who had Erdheim-Chester, who was treated with chemotherapy, and you can see the decrease here. So in terms of response to neuroprotective antioxidants, the question is this an early biomarker that we can use for looking at some of these therapies, the vitamins, the AREDs, this sort of thing? So Bob Rich looked at a group, this is a mixture that he made up for glaucoma, and he looked at a very short period of time, at 1 month, in a randomized double-masked placebo-controlled trial, and you can see there's significant reduction that he could measure in the flavoprotein fluorescence compared to the placebo. So in summary, mitochondrial oxidative stress is a key factor in many retinal degenerative diseases. And flavoprotein fluorescence imaging is a clinically accessible tool for measuring slow substructural damage due to mitochondrial oxidative stress. So flavoprotein fluorescence shows promise as a biomarker for monitoring early prestructural responses. Ongoing trials and follow-up studies should provide further evidence of the value of this technology for management of retinal degenerative diseases. Thank you.